Hi everyone. Most of the modern day diseases have their roots in inflammation. And when there is inflammation, the most common medications prescribed for inflammation are NSAIDs or non-steroidal anti-inflammatory drugs. So in this video, I want to quickly share the very serious but common side effects of these medications called NSAIDs. So the examples of these medications are aspirin, ibuprofen, naprofen, indomethacin or Indoseed, and etc. So what is the purpose of these medications? These medications are prescribed when a client have inflammation, that is redness, swelling, heat, and then pain and fever. So when a patient have inflammation, pain and fever, most commonly health workers will prescribe NSAIDs. So what is the purpose of NSAIDs? The purpose of NSAIDs is to stop or inhibit or block function of a special chemical called Prostaglandin. So the purpose of these NSAID drugs like aspirin and ibuprofen, naprofen, indomethacin is to block the function or stop or inhibit the function of prostaglandin. So why do we have to inhibit or stop the function of prostaglandin? Prostaglandin is responsible for inflammation, pain, and fever. So we'll get into the body and see how that works. Okay. So when there is an infection or when there is a tissue damage, what happens is that, okay, this is our blood vessels, right? This is our blood vessels and this is the tissue. And if you have, if you are poked by a stick or a nail, and you have tissue damage, the damaged tissues or cells will release some chemicals that will attract. It's like an emergency signal or stress signal. And then within your blood vessels, you would have what is called a monocyte, right? So this one is a monocyte, this one. So a monocyte in the nearby blood vessel will now move into the tissues. Once the monocyte gets into the tissues, it will differentiate into what is called a macrophage. Macrophage or a big eater. So what will this person do in the inflamed tissues? Remember, you have like inflammation, redness, and also you have this swelling at the local site. So what will happen? So this person or these macrophages have a lot of these fat fatty acid in it called this prostaglandin. So now this person, these macrophages will start to release these prostaglandins. It will start to secrete prostaglandins into the tissues. The first thing that will happen is that this prostaglandin will come and stimulate these blood vessels, and they will cause dilation, that is enlargement of the blood vessels. So when this blood vessel dilate, becomes larger, you would have a lot of blood flowing through. So there would be an increase in blood flow. So there would be an increase in blood flow. When there is an increase in blood flow, it will bring a lot of white blood cells and other cells that will start to do the repair process, or they will also kill bacteria or viruses that gets into the skin or that is causing the infection. But there is also one thing that it does. So let's say one of the functions here is of prostaglandin is vasodilation. Okay. Vasodilation that is caused by secretion of these prostaglandins. When there is dilation, what will happen to the cells? So these black squares are cells lining the blood vessels. So now as the blood vessel dilate, the cells will move apart. So let's say this is the normal cells. So they are close together, so they prevent substances from moving in and out freely. But now when it dilates, it increases the permeability of the blood vessels. So what happens is that now your cells, the blood cells or the cells lining the blood vessel will increase the space between them. In that way, they will increase the permeability of the cell. So what will happen now is that a lot of through this gap, a lot of water will move into the tissues. Water will move into the tissues, and that is the one that will cause the swelling. And then a lot of blood, that's why there will be heat as well as redness in the infected area or in the damaged tissues. But when there is an increase in permeability, also a lot of white blood cells are moving into the tissues to start the healing process. Okay, what is another thing that prostaglandin will do? This prostaglandin, what happens is that they will come and then they will sensitize this person. Sensitize. Okay, so they will sensitize this person here, this red structure here. What is this? This one is a nociceptor. Nociceptor is a pain receptor in the tissues, right? So this prostaglandin will sensitize these nociceptors that are responsible for transmitting pain signals or detecting anything that causes pain. So when there is swelling, it will compress these nociceptors. So now they will send message to the to the brainstem, and then somewhere into the brain, and that will be perceived as pain. So the reason why you would feel pain in inflammation is because of these prostaglandins sensitizing these nociceptors. Okay, one more thing. Why there is fever? Sometimes you would have fever, sometimes you will not have fever. What happens is that this prostaglandin E2 will get into the blood and then will circulate to a certain location, certain part of the brain in the hypothalamus, called preoptic hypothalamus, and in a special cells in the hypothalamus where it is responsible for regulating the body temperature, or the thermoregulation center. There are special cells, so it will bind onto EP3 receptors on the cells in the hypothalamus, and then they will, what happens is that once this prostaglandin binds onto EP3 receptors, what will happen is that the body will start to increase heat production, and also it will decrease heat loss. So the overall effect is that there will be an increase in body temperature. That is the reason why you would have fever in inflammation. Okay, so here you have the prostaglandin that is causing vasodilation, bringing a lot of blood and water, gets into the tissues, causing swelling, sensitize the nociceptors, so you experience pain, and also stimulates the thermoreceptors, or stimulate the thermoregulatory center in the hypothalamus, so it increases body temperature. So the purpose of these NSAIDs is to stop the function of prostaglandin. So if they can stop the function of prostaglandin, you would not have inflammation, pain, and fever. So how does that happen? Now let's zoom right into this person. So this is the same person, macrophage here. So we will zoom into the plasma membrane, or the cell wall of this macrophage. Okay, let's zoom in and see. So these ones are the cell wall. These are phospholipid. You have two layers, so they are called phospholipid bilayer. This is the head and the tail here. So within the plasma membrane, embedded within the plasma membrane of these macrophages, are two enzymes, similar enzymes. So this one, let's start with this one. This one is called COX-2. COX-2 stands for cyclooxygenase type 2. Okay, so what will happen is that, what is the function of this COX-2? COX-2 will take what is called a particular acid called arachidonic acid. This arachidonic acid will go in here. Somewhere in here there is a special site here. So it will take this arachidonic acid AA, and then it will produce a prostaglandin. It will produce this fellow. This prostaglandin is responsible for inflammation, pain, and fever. So it will produce this prostaglandin. Or we can just call it, PG, right? So this prostaglandin produced by COX-2 enzyme from arachidonic acid is responsible for fever, inflammation, and pain. Remember that inflammation is a good thing when it is acute, because it promotes healing of the damaged tissues. But when inflammation becomes chronic, then that is a problem. So what is this thing? Okay, let's see. This one is called cyclooxygenase type 2. We call it COX1 or cyclooxygenase type 1. So what is the function of this one? So this enzyme is same as this one, but this one is type 2 and this one is type 1. So what this one will do is that the same thing, it will take the AA, it will take the arachidonic acid AA, and then it will produce this one. This one is called prostaglandin E2 or PGE2. This one. Also, it will produce another thing. Another thing here. Let me just here. It will produce another thing called TXA2. TXA2 stands for thromboxane A2. This one is involved in blood clotting. So you see, this enzyme produces a lot of good stuff. So we have prostaglandins that help in the fever, pain, and inflammation that promotes healing, and also thromboxane A2, which is responsible for, which is involved in blood clot. But it also produces prostaglandin E2. What is the function of prostaglandin E2? This one is responsible for GI protection. Specifically, it protects our stomach. Remember that prostaglandin have a lot of other physiological functions in the body. It involves in labor, in menstruation, It involves in bronchoconstriction in the respiratory tract, and it has many other functions. But one of them is GI protection. And how does it protect our stomach? Let's go over to the stomach and see how that happens. Okay, in the stomach we have a couple of cells, and I will talk about three of them. So lining the stomach, we have this cell here. This one is called chief cell, right? Sorry, it is called the chief cell. Okay, this chief cell secretes what is called pepsinogen. This chief cell produces an enzyme called pepsinogen. This one is called a parietal cell, right? So this one is parietal cell. This cell, parietal cell, secretes HCl, secretes hydrochloric acid. The pH is around 1, 2, or 3. So it is very acidic and it is very corrosive. What will happen? This one, once it is secreted into the stomach, it is secreted into an acidic environment and it will be activated to become pepsin. Pepsin is the active form, and the function of the pepsin is to digest proteins. It breaks down proteins. And hydrochloric acid functions to activate this pepsin as well as kill any bacteria that gets into our stomach with food, and also helps in the digestion of proteins. It denatures proteins in the stomach. When you eat a nice chicken, first the hydrochloric acid will denature it, unfold the proteins, and then it is this pepsin that will digest the proteins, break them down into peptides and amino acids that can be absorbed in the intestines. But these two can also digest other proteins in the stomach. Hydrochloric acid is, have pH of around 2 to 3, and it is corrosive. It can burn the tissues in here, as well as this pepsin can digest our own cells, because our cells are made up of proteins and fats, so it can digest proteins, right? This one is responsible for protein digestion, right? But here is the important thing. This cell is called mucus cells. So we have two types of mucus cells, but let's say this is a mucus cell, and the mucus cell will secrete an alkaline mucus. So these mucus cells will secrete alkaline mucus. That means that they secrete mucus, and within the mucus they have a bicarbonate, HCO3. So what is the function of the mucus? The mucus will come and sit on top of the cells here. They will sit on top of these cells. So about 1 to 3 mil thick, and mucus provides a physical barrier. It protects the lining of the stomach from hydrochloric acid and pepsin, so that this pepsin and hydrochloric acid won't irritate or won't digest the stomach lining. But also the alkaline, the bicarbonate in the mucus also will neutralize hydrochloric acid. Every time when the hydrochloric acid comes in contact with these cells lining the stomach, it will be neutralized. So it won't digest or destroy the cells lining the gastric acid. So the 1 to 3 mil thick mucus must be maintained every time, because that is what provides a physical barrier from, it protects the stomach lining from pepsin and hydrochloric acid. Now let's come back here. The function of these NSAIDs like aspirin and ibuprofen is to inhibit. They will inhibit this enzyme. They will come and block this site. They will block this site so that the COX-2 and COX-1 will not produce these prostaglandins. So when they block this prostaglandin, then there is no fever, no pain, and they reduce inflammation. But these NSAIDs like aspirin and ibuprofen will also block COX-1 enzyme, cyclooxygenase type 1. When they block this one, then there won't be prostaglandin E2, or they will reduce the amount of prostaglandin prostaglandin E2. When that happens, the function of this prostaglandin E2 is to stimulate these mucus cells to secrete the alkaline mucus. So this one, prostaglandin E2, stimulates the mucus cells to secrete mucus. So when there is no prostaglandin, or if COX-1 enzyme is inhibited, then there will be a reduce in prostaglandin E2. When there is a reduce in prostaglandin E2 in the stomach, then there will also be reduce in mucus secretion. So what will happen when there is a reduce in mucus secretions? So this one, as I've mentioned, it's supposed to be, normally it should be 1 to 3 mil thick. But when there is a reduction in the prostaglandin E2, then there will be also a reduction in mucus secretion. So this one will becomes thinner and thinner, maybe less than 1 mil. Now this pepsin and hydrochloric acid will start to irritate the stomach lining now. So you will start with irritation. Irritation can lead to inflammation. So this lining will start to be inflamed because pepsin and hydrochloric acid will start to irritate it, and then you can have erosion of the lining of the stomach, and eventually peptic ulcer will develop. So this is one of the common but serious side effects of NSAIDs. If you are taking NSAIDs for like 1 week or so, it won't affect you, though it will reduce the amount of prostaglandin. But once you stop taking the drug, the COX-1 enzymes will start do their work, and they will produce prostaglandin into that will stimulate the mucous cells to secrete mucus, and it will protect the lining of the stomach. But if you are going to take prostaglandin for chronic inflammation for extended period of time, then this is a problem now. So in the next video, I will talk about what you can do when you have a chronic inflammation. So just to recap, NSAIDs are produced, or NSAIDs are prescribed for inflammation, pain, and fever. Examples are aspirin, ibuprofen, and indomethacin. So what happens is they will go and inhibit COX-2 enzymes, and COX-2 enzymes won't produce prostaglandin, or will reduce the production of prostaglandin, and that will reduce fever, inflammation, and pain. But also it inhibits COX-1 enzyme. When there is inhibition of COX-1 enzyme, then it will decrease or stop the production of prostaglandin E2 that is responsible for GI protection. So when there is reduction in prostaglandin E2, then there will be a reduction in alkaline mucus secretion. When you have less mucus, less than 3 mils or 1 mil, then this pepsin and hydrochloric acid will start irritate the lining of the stomach. That can lead to irritation, inflammation, erosion, and eventually you will develop a peptic ulcer. Thank you for watching.